June 2020, empty streets, places of worship, schools, offices, and other public places under lock and key. Total lockdown. Fast forward to 2022. And life is back to normal. Just when Nigerians thought the storm of COVID-19 pandemic was over, the virus continues to stick out its ugly head. COVID-19 cases have continued to increase in some parts of the world. In the United Kingdom, for instance, officials say COVID restrictions may be reintroduced if rising number of cases imparts on the National Health Scheme. In Nigeria, an analysis of COVID-19 statistics obtained from the Nigerian Center for Disease Control (NCDC) revealed a sharp rise of 324% in the number of COVID-19 cases reported in the country within 1 month. The agency had notified Nigerians of the possibility of a fifth wave of the pandemic. Between May 12 and June 12, 2022, about 568 cases were reported in the country. Nigeria's commercial capital, Lagos, is driving Nigeria's latest COVID-19 surge as the country recorded 247 infections between June 21 and 24, 2022. However, between June 13 and July 12, 2022, no fewer than 2,407 cases were reported, leading to a sharp rise of 323.76% in the number of positive cases. It appears Nigerians have moved on from the issues of COVID-19, but unfortunately, the virus is still here, still real and deadly. And we're in the streets of Lagos to find out from Nigerians if they know this, that the virus is still here and are keeping up with the preventive protocols. While some Nigerians believe the pandemic is real and are still observing the preventive protocols, others cannot be bothered.
As for me, I don't believe there is anything like COVID-19 right from time. But I wash my hands frequently. I make sure I keep myself neat at times, though not all the COVID-19 procedures that I do follow.
We need to continue and adhere to it, because when it was coming, we were not informed. And if it comes again, you don't know when and how it's going to come. So we need to be cautious. That's what I see. So we don't just give up. We have to continue to protect ourselves against it. We don't know who is carrying it.
Because of the religion, most people don't believe it. Most people believe it. Understand me? And it depends on individual person. For me, I still believe it is, and I still believe what people should continue to abide with the rules and regulations of that COVID.
To be honest, I can't say it's not still around, but at least, yeah, I think I've tried to keep with the preventive measures. As you can see, like, I have my masks on. But when I want to get into a crowded place, I usually use my mask and use the hand sanitizers and all that.
Yes, not just because of COVID-19, but because of other respiratory tract diseases that are in existence.
COVID-19 is no more in existence again now. I think everything is over. In fact, throughout the whole world, I don't think there is anywhere that they have been talking about the COVID anymore.
I don't really believe that there's COVID-19 again. And I wash my hands regularly just for the sake of washing it. And I use nose masks so that just for protecting myself against it in case it's real.
There has been a disregard for COVID-19 protocols around the world. As people now board a flight without a COVID-19 test, marketplaces are crowded and religious gatherings are filled up with political movements on the increase. Chairman, International Institute of Advanced Research and Training, Chidicom Medical Center, Wari, Dr. Philip Njamanza says the spike in the number of COVID-19 cases is expected, but noted that it's nothing to worry about as the world is dealing with a virus that has its own lifestyle and natural ecosystems, just like every other disease. He believes the Western world has a lot to learn from Nigerians regarding the way the country has managed and dealt with the infection so far.
It's nothing to panic about. This is the normal kind of trajectory of most viral infections. At first, what normally happens when a viral infection hits, it is very new to the immune system, and the immune system starts responding to it. During that time, you have a space of time when a lot of people could get infected. Much later, the dynamic starts changing. The virus starts kind of developing a way to evade the immune system. And also, we get better at testing. You remember before we were talking about hundreds of thousands. Now we are talking about 5.3 million tests going on. So in the country, and haven't gone on in the country. So it also reflects the vigilance about the disease, that we are now actually finding more cases that are there, and we're just getting better at diagnosing them. But it's not a big concern from the point of view that there is a resurgence of the pandemic. No, it's not. It's just a reflection of the fact that you are getting better at your system evaluation, the system detection systems in the states and in all the places where you have vigilance posts around the country. That's one. And secondly, it also reflects the dynamics of the virus in terms of trying to adapt. This has been an infection with us for a very long time. There is already some societal, or what we call medically herd immunity to this in our society. So really, I wouldn't like people to just look at numbers and start panicking. Gone are the days when we used to raise so much alarm about COVID-19. Now it is a disease here to stay with us, just like we have all other diseases, and we have adapted to it very well. And our country has done very, very well. Both congratulate the NCDC and all the health institutions, and we in the private sector, we have also done our part to be vigilant, and our country has come up very top on this in this whole pandemic. And that actually shows the superiority of our approaches to infectious diseases.
CEO of Live Well Initiative, Dr. Bisi Bright, Professor Oyewale Tomori, Nigerian Professor of Virology, and CEO Medway Health Limited, Dr. Tuyi Mebawondo, all agree that there is no cause for alarm on the new increase of COVID-19 cases, though they called for caution.
The NCDC is the authoritative organ that can tell us exactly what's happening. So definitely they have not exaggerated the numbers. I believe very strongly that those are the figures, even if they're not going to be more than that, because remember, there is little or no testing going on right now. Now, there is something called the long COVID, and I believe very much that a lot of these new cases are either cases of long COVID that are just being detected now due to past non-testing, and so a person who's had COVID and was not detected now goes into long COVID, and the person is persistently presenting with symptoms and is ill and is now forced to go to the health system. Even outside of Nigeria, globally, there are a lot of cases of COVID going on. Last week I was in a webinar, a liver health meeting. We are on the conference planning committee, and out of about 12 of us at the meeting, almost 10 people were coughing, and they were symptomatic, they were sick, and 2 or 3 of them actually recused themselves that they'll be quiet, they won't speak because they were being treated for COVID. And these are people from The meeting had people from Europe, from all over the world, and they had all just gone for a meeting in the UK, and they all went back to their various countries with COVID. I'm not saying they picked it in the UK, but definitely there's still a lot of COVID everywhere in the world, including Nigeria, and people are traveling, moving around, so it's being moved around. It will take a while for the virus to be totally diffused until we have what we call herd immunity. And herd immunity means 70% of the people have had the infection. So that's going to take a while. I really don't think it poses a serious danger, because if you look at a disease, for any disease at all, there's a disease cycle. You have the peak, and then you have the plateau, and then it starts to go down. So for COVID-19, I believe we've gone past the peak. We were in the plateau for a while, and I believe the disease curve is going to start going down. The fact that we have 324% increase in numbers from those tested last does not mean that it is an actual increase in what has been happening really in the society. So I believe that we've gone to a phase now where the disease is less virulent but more prevalent. So you have more prevalence, more occurrence, but less virulence.
First of all, I think we're making an error to think we have finished with COVID. We have not escaped. There's just a lull. And we're seeing the evidence that the virus is still around. We may be tired of the virus, but the virus is not tired of us. And many more cases will still occur, as is seen in different parts of the world. And this is occasioned by the fact that there are new variants coming out. And how do the variants come out? They are generated by people who are not protected. So when you don't get your people vaccinated, then they then get exposed to the virus. The virus has the opportunity to make new variants, which nullifies all of the efforts we are making about vaccination. The epidemiology of the disease over there is not like what it is here. But then we should have taken advantage of that and prepare better. But of course, it's not a problem. And when you look at what is happening in other parts of the world, there are now new variants, BA4, BA5, which are causing major problems, South Africa and other places. And we have people coming in from all these places into our country. That's why we should be prepared right now, about what is coming. New variants will keep coming because people are not vaccinated.
The virus does not care about your magical thinking. It mutates, and even in a few years, we'll see the mutant strain coming up and the manifestation. In fact, we're still studying the long-term effect of this viral infection. Does it affect capability to reproduce? Does it affect cardiovascular system? Does it affect the brain later in life? Well, you see, we've not understood fully the extent of of the damage that the virus is doing to our body. Now, why would you now think that by just wishing it away, the virus will stop mutating, it will stop having the effect you don't desire? I tell you, science don't reason like that. The best thing for us is not to have any virus, entering our body, any dangerous virus entering our body. And in an environment where we see endemicity of Lassa fever, Marburg fever coming from Ghana, monkeypox becoming now a public health emergency of international concern, and we see the interaction of these viruses or germs in the human body. You don't know the cocktails that you're going to come out. You don't know what is going to come out of it. For us to wake up and to just sit down and fold our arms and be dancing buga, we're wasting our time. Science does not. And then to worsen the whole matter, we have a broken health system. Doctors are running away, nurses are running away. There's no fund. And the fund to attempt to challenge the health system will be more dire, especially if the partners are not dropping money.
On vaccination, NCDC noted that 11,873,847 have been partially vaccinated, representing only 10.6% of the total eligible population. The experts stressed the importance of vaccination, but pointed out that people should not relax on the fact that they had been vaccinated, especially the vulnerable ones.
People should know this, and this is the frank medical position. The fact that you got a vaccine does not mean you are going to be prevented. It just means that maybe it will help you to defend yourself from a severe form of the infection. So hospitalization will be less, and the severity of the clinical presentations will be much lesser in a vaccinated than an unvaccinated person. So that's the medical position. But that it actually will prevent you from getting an infection is not true, and it shouldn't be the view. There are people who have been vaccinated and they still die from complications. But you have to always look at the background of the disease. When you have some people who have severe comorbidities, as we call them, that means they have all the diseases that will kill them. The fact that you took the jab, which only works for COVID-19, does not really work for diabetes, doesn't work for hypertension, it doesn't work for complications of stroke. So basically, the fact that you took the jab does not mean that you will still not come down with a very serious complication.
Those who are not vaccinated can just pick the virus and they end up getting into the phase where they get into real trouble. The cytokine storm is what kills people in COVID. Now, that storm can be avoided if a person is vaccinated, because vaccination prefers protection on a person. The person who is vaccinated can still have COVID, but will have mild COVID. Now, when COVID progresses into the cytokine storm, it means the virus has multiplied, incubated along the respiratory tract and descended into the lungs, and the viruses now take the place of oxygen inside the lungs, so that person would choke and it could kill them easily.
It's evidence that the problem is still with us, and therefore each of us, especially those who have not been vaccinated, are still in danger of getting infected. And my advice would be, anytime you have a chance to go out into where a large number of people are congregating, please wear your mask. When you are locked up in a room, when you're at a meeting, at church services, in congregations, where a lot of people are around, and you are not vaccinated, please wear your mask. Even when you are vaccinated, please wear your mask, because new variants are coming out that can still override, to some extent, the immunity that we have. And remember, immunity will wane with time. Even those of us who are fully immunized, over a period of time, our level of immunity will go down, which means we can still be more susceptible. Therefore, I think everybody, no vaccine that is 100% efficacious. The best of vaccine, which was yellow fever, gives you about 90%. So even no matter what, even when you're vaccinated, then remember, your response to a vaccine depends on your own state of health. If you have other comorbidities, have other problems, immunocompromised disease and things like that, the fact that you're fully vaccinated doesn't mean you are fully protected. So since you don't know that, be on the safe side.
What we have seen is that the vaccines have prevented death remarkably. All we're seeing, all the figure we're seeing, die, has gone down. So it becomes important for us to know that the singular public health intervention to beat back the pandemic has been vaccination. Not only that it prevents the most severe form of the disease, it also prevents transmission of the disease. So now it doesn't mean that the disease cannot be transmitted. It doesn't mean that you cannot still pick the virus when you're vaccinated. It's just like somebody say that, okay, I'm using family planning, that I cannot get pregnant. It can still happen. But we're saying that the chance of it happening becomes low, and that's what we want to really achieve. And if we can really get to that point of getting the herd immunity, massive vaccination, yes, it has been done in other places, but because the virus is mutating, we're seeing the reinfection, because the virus is also trying to get smart.
The further urged Nigerians to take personal responsibility for their health, while tasking the government with sensitizing the public on the pandemic.
It's better we all prepare. I agree with that. And how do we prepare? I believe very much in taking antioxidants. I know that's not one of the things that NCDC recommends. They are talking about the vaccination, but antioxidants are very good for boosting immunity. We need immune boosters, and there are very good immune boosters that will help to keep a person really healthy, even in a pandemic era. I think the NCDC, being an arm of the Federal Ministry of Health, should work with the Public Health Department in the Federal Ministry of Health to put billboards out there so that people along the road, when they're going, they just get this big message, the billboard that tells them wear your mask, COVID is still here or something. And then maybe on air and then in the social media, government can sensitize people through their Twitter handles, and because government also has Twitter handles, they are on Facebook, they are on LinkedIn and so on. So the government organs should go out there and inform people and remind them. But if everywhere is quiet as it is now, I tell you, nobody would believe it. And we hope that it would not come with a big bang and then hit people in an unexpected manner.
What we should be more concerned about is how vigilant are we? Are we really testing where we should be testing? Are we really getting people the preventive measures where we need it? Are we really actually building the system responses in the different localities? And as an individual, what do you do to protect yourself from COVID-19 and every other infections? So we really would say that people should be more health conscious, and probably, if anything, people should take home with in this whole pandemic is that they ought to be responsible for their health. Take personal responsibility. It is not the responsibility of government, it's not the responsibility of society to take care of you and your health. You are actually at the center. You're the one to report your symptoms, you're the one to go for the tests, you're the one to take vaccine when it's necessary. So you are at the center of your health. We inherited a very, very bad colonial system of health, which only taught us that health is just about treatment, the therapeutic arm. Health has three arms. One is treatment, two, prevention, and three, research. These are the tripod that holds the health. We just started the NCDC just not too long ago. I mean, it was actually almost deficient. What we had, the sanitary health system, was not sufficient, it was not really very systematic. We really need a comprehensive arm as large at every level of governance, beginning federal, the state, and at the local government. We need the NCDC even of your ward, so that we can get reports right to the world system. So what the Nigerian government should do is to expand the system, build a more diverse and actually in-depth NCDC at all levels, and then make sure it is not a unitary system, that is not run from Abuja. It is a system that is independent both at the state level and at the local government level, and everybody being able, there should be a Surgeon General of your ward.
I'm a bit worried about the way NCDC is bringing the data. Coming out a week later to tell me that I have an upsurge doesn't help me. I should have those data as they are occurring. Now they're pulling results together and say in the week or so the number went to 3,000. I mean, you're going to tell me what happened since last week. By that time, I will have been exposed. So we need to get that data. Maybe I should have said that even. We need to get NCDC giving us data regularly, not in their website, but put out in the public like news on a daily basis. So that way people are aware. How many people read their website? They must use a method where they can reach the people as quickly as possible. There was a time when NTA used to put the details every day, but now I don't think they ever put anything anymore. And then suddenly you wake up 2 weeks later, say, the number has gone to 3,000. I mean, people will take you serious,
Our government must keep reminding us the jingles, the warnings on radio should come back, the warnings on television should come back. The public space should be approached with such caution. I think the idea of having to cancel the incident commander and the presidential task force, that was discussing the COVID before, I've not heard anything from them for a long time. Where are they? What are they doing? Why have they kept quiet? They should be bold enough to brief us that they used to do. Even if you're not doing a daily briefing, do a weekly briefing. This is the situation. This is where we are. And then we have to actually figure out how to build our health system, especially at the local level. But it's tough. It's pretty tough. But individual, we have to target individual to embrace preventive measures.
Meanwhile, efforts to get the angle of the Commissioner of Health Lagos State proved abortive. So far, according to NCDC, a total of 258,874 positive cases have been reported in Nigeria since the beginning of the pandemic in 2020, while 250,456 have been discharged and 3,144 have lost their lives. It is therefore important for the government to intensify testing and do more in vaccinating its citizens so that the proportion of fully immunized people will be high enough to have herd immunity.